Bismillahirrahmanirrahim. Auzubillahi minash-shaytanir-rajim. I start the CME with the name of Allah, most beneficial and merciful. The topic of update of CME by Mother and Child Survival Group of Pakistan is a brief review of breech presentation. Breech presentation is when the lie is longitudinal, but the presenting part, the buttocks, they are present in the pelvis, and the head is in the fundus of the uterus. Breech presentation occurs, and they have the frequency of 3 to 4% in pregnancy, but has increased incidence before term. For preterm, breech deliveries are common. Types of breech: extended breech, in which both the feet are extended with head, and 70%. There is a flex breech, in which both the feet are flexed at knee. This is 15%, and then there is a foot-link breech, one leg and one leg and feet, they are extended, foot-link breech. What are the causes? They are preterm, idiopathic, history of breech deliveries, placenta previa and other congenital abnormalities, Mullerian abnormalities, and the fibroid uterus. The polyhydramnias and congenital abnormalities, extra. There is great trauma and fetal risk to the babies are, there is a great trauma and hypoxia to the babies and conducting their normal deliveries. Trauma is the most common, and the other reason for these risks are up till now not understood, and then we had to go for this. For breech presentation, we go for the elective C-sections, and then we can have the breech delivery. Most preterm breech deliveries, they are preterm, and at term we can have an option of external cephalic version. In external cephalic version, the breech is disimpacted from the pelvis and then pushed up on the side, and then by pressing the occiput, the forward roll is completed. Mostly breech, when they are not labor, is not a matter of any concern. Before 36 weeks of labor, they are concerned only when they are having more than 37 weeks and are in labor. They are delivered by C-section, and external cephalic version is also a method through which we can convert them, the lie, into longitudinal one, cephalic one. And the maternal mortality and morbidity is also increased with this. The Royal College guidelines is for primary breech is a elective C-section. Emergency C-section also when there is any leaking or when there is any labor pains they have started. It all depends upon the negotiating of the fetus to the pelvis, size and association with other abnormality. So takeaway lesson is pray, praise, trust, love God, for God Almighty Allah, and follow Sayyidina Sallallahu Alaihi Wasallam. Thank you very much.